So now we're going to talk about general physical examination in a series of short videos. The difference between an excellent clinician and just an okay clinician is you need to have really good critical thinking skills, you need to have great communication skills, you need to be able to take a good history, thorough history, and do a very thorough physical examination. We're going to focus on the physical examination part. And I really can't overemphasize the importance of physical examination. We don't speak their language. They can't tell us where it hurts specifically, so we need to use our observational skills to try and figure that out, just like pediatrics. And so there's some basic principles of physical examination which will optimize your chances of being able to get the information that you need in order to help your patients. And one of the most important principles, for pretty much any procedure that you're going to do in veterinary medicine is to try and optimize the comfort for the patient. If they're more comfortable, they're more likely to be compliant and allow you to do the procedures that you need to do. From a physical exam perspective, if it's more comfortable, it's also safer for you. So if you hurt the animal, they're more likely to react. And that gets to one of the principles of physical exam is that if you know one spot is painful, if they're lame in that leg, you tend to put that off until the end of the examination. You adjust your examination to look at the problem last so that you get one, so you don't get tunnel vision and focus on the problem, but also so that you don't make the patient upset and lose an opportunity to evaluate the rest of the animal. And so, so you need to focus on the comfort of the patient. And that's true for physical exam, for venipuncture, for most procedures. The other thing that's true for pretty much everything we do is to optimize your conditions. You want to have the right lighting, you want to have the right environment, you want to have the animal in the right position so that you can be able to do and evaluate what you need to evaluate. You can't adequately escult an animal if you're in a kennel where they're all barking. You're not going to be able to hear subtleties. And the same goes for positioning, whether that's venipuncture or a CSF tap or trying to palpate the lymph nodes. You need to position the animal in a way that's going to optimize your chances of success. The other part that's not a hard and fast rule is to try and make it as ergonomic for the clinician as possible. It is easier for you to do your job if your hands are in a comfortable position, if your body's in a comfortable position, than if you're standing on your head or trying to palpate a lymph node with your hand bent backwards. So change the position of the patient, change the position of your hand, of your body, in order to make it easiest for you to do what you're trying to do. And then you want to focus on what I summarize as a lot of the S's. So you want to use all of your senses. Right now I have a stuffed up nose, so I'm not as good a clinician because I can't smell my patients as I'm evaluating their, looking down in their ear canal and can detect a yeast odor, for instance. So you want to use all of your senses, your fingers, your ears, your sense of smell, and of course your observation. So you're observing things as well as palpating them. You want to use all your senses. You also want to remember that the advantage of doing an exam is that our patients are adorable. This is Taz, and he's a handsome guy, and he's symmetrical. So you can use the symmetry of animals in order to detect abnormalities. If they're asymmetrical, that might suggest that there's a problem. So you also want to, the other S in this list is that most things you can't actually grasp. You can't grab a hold of them, like maybe a tumor under the skin you might be able to grasp, but most structures you slide them. So for a lymph node, you're going to slide it to the limits of its mobility and then it's going to snap back. So you make your hand into sort of a C-type shape and you're going to grasp the soft tissues and slide until something slides through your fingers and snaps back, and that's how you learn where it is, its contour, its size, and you also, by learning where it snaps back, the limits of its mobility, if you then need to go back and collect a sample from it, for instance, you slide it to just less than that limit of mobility, so now you have it localized and immobilized, so you're able to put a needle into it in order to do your needle aspirate or collect some other sample. And so you're going to use your senses, you're going to rely on symmetry of the patient, you're going to slide rather than grasp, and it's also important to, I think it's helpful to slow down. Very often we're kind of in a hurry to get through examinations. We ask you to hurry up in the clinic. You need to do your exam in history in 20 minutes or so. But certain parts of the exam you have to go slowly, like abdominal palpation, and we have another video section on that. And going more slowly is more comfortable for the patient. Gets back to that first principle of comfort. And it also increases your chances of being able to find what you need to. And so slow down. And the last S in the list would be using a soft focus. There are certain things where you really want to look very closely at one particular spot, and you're focused in on that particular spot. But the general exam, like for instance when you're doing an oral exam, which we'll talk about later, having a little bit more of a soft focus so that you can see more globally the whole patient allows you to pick up on things, particularly if you train yourself to look at that level. That's the advantage of those key skills I was talking about, like critical thinking and history taking and problem solving and physical exam. These are all learned skills. You can get better at them if you practice them a lot. And that gets to one of the key points of physical exam. You just have to practice, practice, practice. The more you practice, the better your skills will get. You'll get the motor memory you need in order to position your hands in the right way to be able to find the structures that you're looking for. And so, so remember to look at the painful spot last. Adjust the position of the animal to optimize your chances of finding things. Slow down if you need to. Use a soft focus at times as well as a fine focus when you have when you find an abnormality that you need to look at more carefully. So, next to talk about palpation. We'll talk about a general examination, but I'm going to focus a little bit on lymph node palpation first because that allows us to discuss sort of the manipulative techniques of palpation.